I'm Dr. Lewis Woods, Director of Pediatrics for the West Oakland Health Center. I'm going to discuss today a topic which will be on this DVD. The topic will be obesity, and emphasizing the fact that the percentage of children who are obese is increasing in an alarming way, to such an extent that this is what we are now calling it an epidemic. Not only are we seeing this increase in obesity here in the United States, but also we're seeing it in children worldwide. And it's gotten to the point now where a subtitle for this talk might be the supersizing of our children. I want to emphasize the fact that although this problem with being overweight and obesity is increasing at an alarming rate, I'd like to emphasize the point that this is a very, very preventable condition. In fact, it's the #1 most preventable condition in children, and it's second in adults only to tobacco use. I'd like to emphasize also that our population that we serve here at the West Oakland Health Center, particularly our minority population, these children are most often affected by the problem that we see with obesity. That is, the children who are Hispanic, Black, or American Indians have a very, very high incidence of obesity, much more so than other aspects of our population. In our minority children, particularly in the population that we serve here at the West Oakland Health Center, we're seeing 25 to 30% of our children who are overweight. And of that percentage of children who are overweight, we're seeing about 15% of them who are actually what we consider to be truly obese. Obesity as a condition, as a preventable condition, has actually doubled in our children within the last 20 years. And so this is quite alarming, and if the rate of increase of obesity persists, then we'll be seeing maybe another doubling within the next 10 years, and that would be really a devastating have devastating effects to our population. We speak with parents and asking them about their children who come in who are overweight, and ask them, do they consider this to be very serious? And there seems to be a disconnect, because we're finding that many of our parents don't particularly see this as being serious, and certainly not unless it gets to the point where these children are decidedly obese. We're finding also that there seems to be a problem with our obese children coming from parents and families that are obese. And so there is a cultural phenomenon that's going on here. And so parents sometimes will think that this is somewhat genetically determined, or heredity, but we're finding out that this is more of a cultural phenomenon. We're finding that of our teenagers who are obese, we're finding that about 80% of these children who are obese will go on to become obese as adults. So it's particularly important for us as physicians to find these children and identify them at an early age, so that we may be able to intervene and hopefully make certain changes in their lifestyle which can prevent them from becoming overweight. In order for a child to gain 1 pound, that child, or adult for that matter, must consume at least 3,500 calories over their baseline nutritional requirement. So in order to gain a pound, you need to eat an additional 3,500 calories. And that seems like it could be quite a bit, but it happens over a very long period of time, and so one doesn't seem to notice this very easily. We have children who are, particularly teenagers, who are overweight, and many as much as 50 pounds overweight. And what this means is that they've consumed 50 pounds times 3,500 calories. Now that's 175,000 calories to gain that extra 500 pounds. 50 pounds. It seems like a very grim number, but the flip side of that is that if a child or a parent, or for that matter, or an adult, wants to lose weight, then it's pretty easy to do. You simply have to decrease your calories by 300 calories a day, walk for an hour, which will burn off 200 calories a day. So that's 500 calories a day for 7 days a week. That's a pound a week. And in a year's time, that's 52 pounds if that's necessary to be lost. So in a gradual way, it's almost as easy, and I quote, and put in quotes, uneasy, as easy to lose that weight as it is to put it on. I like to emphasize the fact that the onus is on the parents to aid their children in identifying their need to lose weight. And so it's extremely difficult for parents to sort of get the concept that children don't have any discipline, and that it's very, very difficult for them to stick to any kind of plan which will modify their behavior. So the onus is on the parents, for the parents to become the discipline for the child. And that way we can make hopefully some strides in reversing the process that I've discussed. So prevention is the most significant part. It's important for us who are in the healthcare profession to identify those children who are becoming overweight, and for this to be passed on to the parents by the physicians and those of us who are in the healthcare profession. So we can ask the question, what does it mean to be overweight, or what does it mean to be obese? We identify being overweight as a child or a person who is about 50% over their desirable weight. And we also are identifying children who are obese, and those children who are obese are about 20% over their desirable weight. We are measuring weight now, or the percentage of body fat, in the term of what is referred to as body mass index, or BMI. So we can measure the child's height and their weight, and then calculate their body mass index. And this gives us an overall understanding of to what degree that child may or may not be overweight. The normal body mass index for an adult or for a child is between 18 and 25. Any child or adult in that range, we just really don't worry about them. A person who is overweight will have a body mass index between 25 and 30, and anyone who is obese will have a body mass index of greater than 30. In the healthcare profession, we don't like to have children to be terribly concerned about their weight, so we will not tend to focus on ideal weight, but simply as a means of helping their parents to understand that this is a process that needs to intervention, and that we can hopefully improve upon. When I'm working with my patients, I have what is called the pinch test. And the pinch test is where if you can pinch an inch on the side, then that's normal. If you can pinch more than an inch, then to some extent you're overweight. If you can pinch 3 or 4 inches, well then you are